541, welcome back. Are you noticing more mushrooms growing in your yard and in the woods? Well, it's mushroom season and many amateur foragers make potentially deadly mistakes.
Yes, University Hospital's Cleveland Medical Center has been a regional center for the treatment of mushroom poisoning for the past decade. There have already been 3 hospitalizations for severe poisoning, which can damage the liver or potentially be fatal.
Senior health correspondent Monica Robbins introduces us to a very lucky man from Portage County who ate one of the deadliest mushrooms in the state and lived to tell the tale.
Bill Hickman's a beekeeper, often uses a plant identifier app on his phone to know what's growing around the yard for his bees. He found some mushrooms in the yard. The app said they were puffballs, safe and edible. It was wrong.
I ate them for dinner. Thankfully, my wife and son didn't. And about 8 hours later, I became violently ill.
Bill had no idea he'd eaten one of the deadliest mushrooms, known as a death cap or angel destroyer.
Basically, it's about an 80% death rate if you eat one, and I ate 4.
His wife, Tammy, sent a picture of the mushroom to poison control.
If it had been just a mushroom that makes you sick, you would throw up within a couple hours after eating it. So what they look for at poison control is the longer delay of onset illness, the more toxic it is.
Typically within 8 to 12 hours, they develop very severe diarrhea, nausea, and vomiting.
Tammy rushed him to the hospital, where he was then transported to UH Cleveland Medical Center, where they have experience with toxic mushroom poisoning. But the prognosis wasn't good.
He basically was preparing me for the worst. He said that they were expecting that he would be on a donor list for liver transplant. And that would be the good outcome of what they were seeing, that he could die.
Bill's body was shutting down from amatoxin. After the vomiting, things actually get worse.
And that's when the really scary part of this disease comes along. And that's when you start developing inflammation of the liver. Up to 30% of patients, either the onset of lethal illness, death, or the need for an urgent liver transplant.
Fortunately for Bill, UH knew how to access a non-FDA approved amatoxin antidote called Silibin. It took a day to get to him, but it did save his life.
So it about 6-fold reduces your risk of actually potentially having a lethal illness or needing a liver transplant.
So when the doctor comes in and tells you you're heading in the right direction, it gives you a second chance, and it's just amazing.
There will be no more mushrooms in the Hickman house unless they're actually cookies. But Bill's story is one any amateur forager needs to heed.
Did not know there were toxic mushrooms in Ohio.
No more mushrooms, no.
He's not kidding. Now, the scary part of these mushrooms is that they look like other edible mushrooms. They also come in a variety of shapes and sizes and colors, which is why Dr. Golem is warning people, just don't eat them. And that also goes for children and pets. He says dozens of dogs die each year from eating poison mushrooms. So keep pets away from them too. This is something that, believe it or not, it's a real problem. And I've done this story every year this time of year, and there's always a few people who are in the hospital because they ate those mushrooms. And they don't lose their toxin when they're cooked. That's also something important people need to know.
Monica, you made an interesting point in your piece here. You said that the drug that was used, it wasn't FDA approved. Why is that?
It's called Silibin, and it's not FDA approved for a few reasons. The main one is that it's not commonly used. So there are a few pharmaceutical companies willing to make it. It also has to be given within 72 hours, and there's research into potential side effects relating it to the thyroid. So to get it, UH doctors actually had to file a request with the FDA, who then has to approve the use. Then they contact the supplier in Philadelphia, who then has to ship it. It is a huge project just to get this drug, and thank goodness they could get it in time for Bill.
Took a day, but it was worth it.
Wow. Is there any way to test a mushroom before you actually eat it?
You know, if you're going to be picking mushrooms, there is actually a new strip, a test strip that just came out. It was created in the last couple of years. You can check a mushroom to see if it contains amatoxin, but that's the only kind. It's called a moxa test, but I checked the website. They're already sold out. Best advice, do your foraging in the grocery store. Or just, I don't eat mushrooms, so just, you know, you could go that route too, yeah.
Okay. Good advice.
Either one of those work.
Yeah, either one of those work.
Just don't eat them.
Yep.
Sure.
Okay,
Thanks.
Monica, thank you so much.
Sure.